Absolutely. First, let me begin by thanking you for the opportunity to chat with you and to talk about this work. I've already learned so much from it myself, and I know that we're still learning as we go. Our goal, what Kathy Scaler Scott and I wanted to do with this, is have a way of evaluating the impact of cluttering on people's lives, similar to the way we use the Oasis to examine the impact of stuttering on people's lives. And this is particularly interesting to me for a number of reasons. One is people have assumed for so long, incorrectly, I might add, that people who clutter just aren't aware of what's going on, that they're, clueless about their speech differences. And that's clearly not true. But we don't really have a way of documenting and measuring that. And so the purpose of the project was to explore what is it that people who clutter experience in their lives? How can we document that? How can we understand it? In case, from a clinical point of view, we can help to diminish adverse impact, but also from a personal point of view. Cluttering is widely misunderstood. It's not even clear. Some people, some clinicians don't even know about it. And so through this process, we were hoping to be able to educate clinicians as well as people who clutter, who are living with this difference that they may not fully understand, what it is they might be experiencing. And then, of course, ultimately, how might we do something about it? If indeed some people want to pursue treatment, what should that entail? And how do we know if it's on the right track? So that's what the project is about. We started off with the starting point was the Oasis, the overall assessment of the speaker's experience of stuttering. Mm-hmm. That's been around for quite a few years at this point. So we took that as a starting point to develop the overall assessment of the speaker's experience of cluttering, OASEC. Sure. In the stuttering world, what we've been able to document using the Oasis is in part things that people have known for years. Stuttering is more than just stuttering. Stuttering affects more aspects of a person's life than just their speech production. What the Oasis is designed to do then is to measure that, to make it describable, to make it quantifiable in terms of the negative reactions that people might have to their own stuttering, the impact that the environment plays on their daily experience of stuttering, the difficulties that they may have in daily communication at work or at home or for younger ones at school, and the overall impact of stuttering on their quality of life. Because increasingly, some clinicians have known this forever, but increasingly clinicians are recognizing that these are the aspects of a person's life that cause the greatest burden for them. And in therapy, these are the aspects that we want to address in order to reduce that burden. So Kathy and I talked for many years before we actually started the project about, we really need some way of documenting the burden that cluttering places on people. And so we started with the Oasis as a model, but in the end, the tool will look quite different because of the differences between cluttering and stuttering. People have so often sort of lumped them together. Oh, it's another fluency disorder. It's stuttering and cluttering. And what that's probably done is led to some confusion amongst clinicians and even researchers, I would say, about what cluttering is and how it's distinct from stuttering. Certainly, we know many people experience both conditions. So differentiating them is maybe difficult and maybe not necessary. The person's having a difficulty with communication. So whether we call that a cluttering behavior or that a stuttering behavior, I'm not sure that matters. It's, can we help the person have an easier life? So that's where we started in our discussions. But as we talked to people who clutter, like you, as we drew upon Kathy's experience and the experience of many others, we began to see that there's a unique life profile that we want to capture. It's not just differences in the types of disfluencies. It's not just potential differences in awareness. The experiences that people who clutter are having on a day-to-day basis are in many ways unique and different from those that people who stutter may be having. And we want to be clear about documenting those so that any treatment that somebody may pursue, they may not, but if they do pursue that and they do want to make a change, we want to make sure we're treating their actual experience and not just something that we've adapted from stuttering that frankly may or may not apply. This was a big part of my own learning on this, simply due to lack of experience and knowledge. I've certainly, as a speech language pathologist, I've worked with many people who clutter, but and so I had a sense of this, but not to the degree that we're beginning to learn.
Okay.
Far from the idea that people who clutter aren't aware of their communication difficulties, which is what I heard for many years. People who clutter may be acutely aware of the fact that communication is breaking down. And part of the difference here, part of what we're learning is that this seems obvious when we take communication as our metric, saying what you want to say and being heard and understood by the other person and being able to engage in social interaction and dialogue. When we view it from that standpoint, well, of course, people who clutter know what's going on because all their lives they've been told, slow down, say it again, I didn't get that, what are you talking about? Or just people have not engaged with them because of the difficulty in communication. Now, people who stutter experience that too, of course. However, the distinction is in stuttering, people have been focused on the specific behaviors that a person might exhibit, a repetition, for example, or a prolongation or a block. And a lot of the attention has been paid to how listeners perceive those behaviors. And people said, oh, well, in cluttering, they don't necessarily know when they're repeating or prolonging and blocking, so they must not know what's going on. And nothing could be further from the truth. But we've been misled by this focus on what listeners perceive rather than focusing on what speakers perceive. Mm-hmm. And as soon as we do that in stuttering, we begin to get this much fuller picture of the life experience of stuttering. Well, likewise, as soon as we do that in cluttering, we get this robust picture of the difficulties that people who clutter are experiencing with their day-to-day communication, frustration about not being able to get their point across, impatience with other people for not understanding them when they've said what they want to say, also frustration at listeners not necessarily going that little bit extra to engage and to understand, and being aware that there's a difference, not necessarily pinning down the difference to, oh, yes, I exhibited this language behavior. Again, I'm not sure that is relevant for the life experience component. Maybe it'll be relevant to the treatment component, although even there, I'm not entirely sure sometimes. But that focus on communication has opened up, for me at least, a much better understanding of what my clients have been experiencing. And that's a big change, pardon me. When I was a student, a couple of years ago, I won't put a number to it, but when I was a student, I remember my major professor questioning whether cluttering even existed as a clinical category. We don't know about that. We don't know about that. And I heard that for many years. And today, thanks to the work of Kathy Scaler-Scott and Ken St. Louis and Flo Myers and Yvonne Van Zalen and Isabella Rachel and so many others. I always hate to name people because I know I'm going to forget somebody, but there have been a lot of great people who have really carried this work forward to make it clear that absolutely people are experiencing this and that their experiences matter. And that's what we hope to document with the OASEC project, is that those experiences, they matter. And indeed, they may be amenable to support, we know that now, to self-reflection, and perhaps to treatment for some. And so that's important because people who are living their life with frustration and discomfort may be able to find some relief from that so they can communicate more easily. Make room for cluttering. It's part of our field. It's an example of the diversity that people show. Human beings speak in a wide range of ways, and cluttering is just one of those ways. And the more we can recognize that, the more we can set aside from a life perspective some of the quibbles about definition, for example. From a scientific side, absolutely, we need to understand and be able to define and describe the condition, sure. But from a life perspective side, um, I get these questions all the time from clinicians. I'm seeing a child, he's X years old, he's doing this and this and this behavior. What should I call it? Is it cluttering? And I'll say to them, yeah, it may be, it may be. It certainly has elements of cluttered speech, absolutely. But let's take a step back. Is it affecting that student's ability to communicate? And I'll send that email back to people and say, oh, yes, he's very frustrated. Could that be part of cluttering? And my answer is, well, yes, it could be. It's the consequence. It's one of the consequences. Then I'll say, can we help to diminish that frustration, that difficulty they're experiencing? And once they focus that way, clinicians see, oh, yeah, there's a lot we can do here. There's a lot we can draw upon from our existing knowledge about communication, about language therapy, sure, about stuttering therapy, but just about social interaction and how to make social interaction easier for people. And at first, clinicians feel like, oh, it's a whole different diagnosis. It's a whole new thing that I've got to learn. But a lot of clinicians already have skills in language therapy and in social interaction therapy. So once they make room for cluttering in their mind view, they'll say, oh, yeah, I know how to help with that. Once they get fixated on the label, right?
Yeah.
Okay, fine, forget the label, apply it or not, help with communication. And then
Exactly.
people are like, oh, well, I can do that, right? So I'm going to answer in two ways. One is we don't fully know yet because the definition for cluttering is evolving. I mean, we have the least common denominator definition that a lot of people are familiar with. Great. But we're still learning about the day-to-day symptoms that people experience who clutter. In stuttering, there's been a lot of definition, a lot of description of that. But on an emotional level, there are similarities, just as there would be similarities between people who clutter and people who have any other difficulty with communication, and people who stutter, and people who have any other difficulty with communication. So frustration at not being able to get your point across is common, right? Across both. Anger is a normal human emotion. Anger that, you had that opportunity to say what you want to say and they didn't get it. And you want to make sure that they get it. And that follows from the frustration. One that may be different, although I'm not as sure as I used to be, is embarrassment. People who stutter often experience embarrassment about their speech difference. People who clutter do too. There's no question about that. But I'm not clear about whether it's to the same degree or for the same reason. People who stutter, that embarrassment may be about the moment of stuttering, maybe the facial expression that they had, or the trick that they use to try to hide the stutter and they feel embarrassed about later. People who clutter may also experience embarrassment, but maybe there it's more about not getting their point across the way they wanted to, rather than the specific disruption in speech in the moment. So that's a difference that we can explore. Certainly anxiety, very common for both. For people who stutter, it may be anxiety about the fact that I might stutter, anxiety about how others might judge me in that moment or what others might say. People who clutter, when they've been faced with negative reactions from listeners, they may feel the exact same thing. And they may also feel anxiety about, will I be able to make my point? What I want to say here is important, and I'm uncertain about whether or not I'll be able to get the thought from my head into the listener's head, right? Others, social isolation can be significant for people who stutter and people who clutter, maybe for different reasons, but really the end result is the same. Not wanting to go to that party, that office party or whatever, because you're going to have to talk to somebody. And whereas the person who stutters, it may be about having to hide or feeling that they have to hide their stuttering from others. From the person who clutters, it may just be the raw frustration and the raw disappointment of not being able to be understood in that. And recognizing that others comment on those things, others notice it, others may not be as patient. I get the sense from some of my clients that there's a sort of a feedback loop, that when the communication breaks down, the speaker wants even more to get their message across. And so they try even harder, but the listener, having experienced the communication breakdown before, becomes even more impatient. And so this gap is exacerbated. Mm-hmm. So a lot of the emotions are the same: frustration, anger, fear, anxiety, shame about being different. I feel like even though the emotions may be different, the reasons that they're sorry, even though the emotions may be similar, the reasons that they're there might be different. Yet facing them and learning to cope with them is important for both groups in much the same ways. I like that question, because one of the reasons to have a tool is for measurement, sure, but as a clinician, that's not my most interesting reason. My most interesting reason is, can I use this information to help the person who's sitting in front of me, who's come to me for help? Yeah. And indeed, I think we can, because as we develop the metric more, we're identifying new questions to ask that I might not have known to ask before. So I've worked with people who clutter before, where it's a very person-centered process. We understand what are the communication frustrations that you're experiencing. How can we educate your environment about this so that they will be more understanding? And how can we help you recognize when the communication breakdowns are occurring as my client, so that you'll know what strategies are worth trying in that situation? But I've learned even more about how can we just be in that moment and tolerate the frustration, or accommodate the frustration that you're having? How can we improve the ability to acknowledge the cluttering communication breakdown itself in an open way that conveys acceptance right in that moment? To say, everybody will say it their own way, but to say essentially, this communication situation isn't going the way I want. I have something I want to tell you, and I need a couple of extra seconds to say it. Not because I'm speaking slowly, but indeed because I may be speaking quickly, but I want to formulate it just right, so that I'm sure I get it the way I want it to be. And so I've learned that with some of my prior cluttering clients that I've worked with, I maybe could have given them some additional tools that would help them feel better along the way, that frankly I just didn't know. It's a learning process. Everything's a learning process. But I'm hoping that the OASEC data will help to give us insights into those experiences, knowing that maybe I haven't learned that from this particular client, but we'll have this host of data from all of these other people who clutter, who've reported on their experience, that I can say, oh yeah, this is something that some people experience. Is this real for you? Is this something that you're going through? And that gives them the chance to think about it as well. So for me, it's opening my eyes quite a bit. I'm really happy about that, because I hope it'll allow me to do a better job. I think the more that we document the experience, and the more we can point to it specifically and say, look, this is a real issue that people face. And this is an issue that, although it's had maybe a confusing history, a lot of things have, although there is maybe debate about the definition or whatever, there is little debate, or will be little debate, about the life impact. We'll be able to demonstrate and say, hey, look, speech language pathologists, people who clutter experience this. Be on the lookout for it in your therapy. And where I think that might make a difference, for children, for example, school age children, I get a lot of emails about, I'm working with a child, he's got this and this characteristic, and as I mentioned before, is that cluttering? I'll be able to say, well, it may well be cluttering, or it's at least cluttered speech characteristics that we can address. Use an instrument like this that has been developed based on information from a lot of people who experience this, and see how it applies to this individual, and see if it opens up some new avenues for the student to think about, and then also for you as a therapist to think about. And I think doing it that way helps them see that this is real, and we don't have to go around saying, oh, well, there's what's pure cluttering, or what's cluttering and stuttering, or what's cluttering as a characteristic of some other condition. Say this person's experiencing difficulty communicating. Help them if they want help. And I think we can do that. I would hope well, first of all, I hope we're done with developing it. We hope to be done developing it well before then. And that we've moved from the adult version, which is where we've started, into versions for teens and school-age kids. Because there are a lot of school-age kids who experience cluttering or cluttering-like symptoms, cluttering-like behaviors, cluttering-like characteristics that are going unidentified. And so within 5 years, I hope that school clinicians in the US and elsewhere are aware enough about this, that when they see those behaviors, or even more importantly, they hear those reports from their students, they'll know what to do. They'll know to assess it. They'll know to write goals for it in their treatment goals. They'll know not to panic about it or ignore it, or just tell the child to slow down or take a breath or think about what they're saying, or all those ridiculous things. They'll know that it can be distinct from stuttering, so that they can provide appropriate support for the student and for the people in the student's environment that need a lot of education about this. So I hope that through this process, we'll get the kind of concrete knowledge that will help us to educate others, so that others will be more proactive, more aware when a person walks into their room for an assessment, to be able to say, oh, yeah, I see that going on. Let me take out this form and get some experience. Get some information about their experiences, because right now that's really not happening. People are maybe seeing it, but they just don't know what to do about it. Now, there's also a personal bias for me about this. Is I've never been all that into the famous people who stutter thing either.
Okay.
I understand that does bring comfort to some people, but what moves me even more is the not so famous people who stutter.
Sure. Yeah.
Who are out there living their lives that we can actually connect with, right?
Sure, yeah.
In terms of not so famous people who clutter, I can think about some of the clients that I've worked with, very accomplished individuals. I worked with a fellow who was a head of medical research for a major institution, a brilliant individual, and was being judged by his communication. But he had forced his way through his life, not realizing that by learning how to educate others around him about why his speech was different, it could make it easier for him. And so, having him connect, for example, with students who are at the beginning stages of this journey